This special test is called Adsons. So Adsons test primarily looks at something called thoracic outlet syndrome. So thoracic outlet syndrome is a pain or neurological pain going down the arm. It's because of tightness or hypertonicity through the pec minor here, or even the scalenes on the side of the neck here. What they do is they get tight and they compress against the brachial plexus, which obviously goes down through to the arm with the ulnar, median and radial nerves, causing numbness and perhaps a loss of sensation and tingling down through the arm. It also is going to, well, you might also experience some kind of vascular pain as well, or differences, because you have a neurovascular bundle which travels down through the subclavicular space here, and that can get impinged by the same structures, pec minor and scalenes. So the test anyway, so Adsons test is looking at thoracic outlet syndrome. So you're going to grab the client's arm and you're going to find their radial pulse, radial thumb side. So cradle the arm, support it, keep them nice and relaxed. Once you've found the radial pulse, make sure they're not dead. You're going to, nice and strong, you're going to take the arm back into this kind of abducted, horizontally extended position. So you're putting a nice stretch now through pec minor. The pulse should remain. Make sure it is. Then what you're going to do is you're going to ask your client to rotate to look at you, or look at their hand, and again, the pulse should remain. So we put a stretch through pec minor and now through scalenes, so those two possible places where we could get some kind of impingement. And I want you to take a deep breath in and hold your breath. So as she's holding her breath, I should still be able to feel the pulse down through here, which I can. So with Hannah, that's a negative. However, if the pulse went, then you're thinking that's a positive result, and you're in your treatment, your post-care advice plan, you definitely want to be releasing through the pec minor and through scalenes, and often post-care advice exercises or stretches perhaps to try and elongate the muscles. But you'd also want to have a look at their scapulohumeral rhythm. You might need to strengthen the muscles at the back here, the rhomboids and the mid-traps, the ones that retract the girdle, to try and put it into a better position. Let's just show you again that test on this side. So radial pulse. Then what you're going to do is you take the arm back into that horizontally extended position. Turn your head to look at your hand. Make sure the pulse is still there, and then take a deep breath in. So the pulse is still there, so again, it's a negative result for Hannah. Bilaterally on both sides.